Welcome back, everybody. Today, we're going to be diving into something that you're particularly interested in:
Oh,
the impact of face masks, right, on people with COPD,
okay.
especially during the COVID-19 pandemic.
Mm.
And you shared a research paper with us,
I did.
and it's definitely got some eye-opening findings.
It really does. There was so much concern at the height of the pandemic
Yeah,
about whether masks would make it even harder for people with COPD to breathe,
right.
given their existing lung
It
challenges.
makes total sense that people were worried.
Right.
So this study wanted to see if wearing a mask actually increases hypercapnia,
Mm-hmm.
which is a buildup of carbon dioxide in the blood
Yep.
in folks with COPD.
Yeah.
And they focus specifically on patients already managing their COPD with medication.
That's right.
Right.
They looked at 100 patients classified as GOLD, D, B, and C,
Okay.
which means moderate to severe COPD.
Gotcha.
And to make sure everyone was actually wearing their masks consistently.
Yeah.
The researchers had them fill out hourly check-in charts.
Wow.
Talk about a commitment to accurate data.
That's a level of detail I wouldn't have thought of.
Right.
Makes you wonder if that check-in method itself could have impacted the results in some way,
Oh, potentially, for sure.
influencing people to wear masks more consistently than they might otherwise.
Right.
But anyway, what did they find? Did masks cause dangerous CO2 buildup?
The study actually found that wearing masks did not lead to a significant increase in hypercapnia for most participants.
Interesting.
Now, there were a few hospitalized patients who did show higher CO2 levels,
Okay.
but the statistical analysis, something called a p-value, suggests these were likely due to other factors.
Mm.
Think of it this way. A person with COPD is already prone to things like lung infections,
Right.
even beyond COVID.
Yeah.
Those infections can trigger a sudden worsening of their COPD,
Yeah.
called an exacerbation,
Okay.
which could explain those higher CO2 readings rather than the mask itself being the culprit.
So, for the vast majority of participants, wearing a mask didn't seem to have negative consequences in terms of CO2 levels.
Right.
What about their quality of life?
Yeah.
I know you mentioned the study used the CAT score and DASI index to assess that.
Absolutely.
Can you remind us what those are exactly?
Absolutely. The CAD score, or a COPD assessment test, is basically a questionnaire
Mm-hmm.
focusing on the everyday impact of COPD.
Okay.
It asks about things like coughing, breathlessness, how much energy you have.
Gotcha.
The DASI, or Dyspnea Anxiety Spirometry Index, is more focused on the interplay between shortness of breath,
Okay.
anxiety, and actual lung function.
So if I'm understanding this right, they're trying to get a complete picture.
Exactly.
Not just how well someone's lungs are working in a technical sense,
Right.
but also how COPD affects their daily life and emotional well-being.
Absolutely.
What did those scores show in this mask study?
The results were quite positive.
Okay.
Neither the CAT score nor the DASI index showed any negative impact from wearing masks. So it seems that for most people with COPD in this study,
Yeah.
masks didn't worsen their symptoms, limit their activities, or increase their anxiety.
Wow.
Of course, we have to remember these scores are subjective.
Right.
They rely on how the patient themselves is feeling.
Which is valuable information,
Mhm.
but it also means we need to be a bit cautious about drawing sweeping conclusions.
Sure.
Still, it's reassuring for people with COPD who might be worried about masks making their breathing feel worse.
Exactly.
And speaking of breathing concerns, one of the most fascinating findings was related to COVID-19 itself.
Oh, yeah, absolutely.
Oh, right.
Okay.
You mentioned earlier that the study took place during the pandemic.
Yes.
Was there a difference in infection rates between those who wore masks and those who didn't?
Well, they didn't have a group that didn't wear masks.
Right.
Everyone in the study was instructed to wear masks regularly.
Sure.
And under those conditions, the incidence of COVID-19 infection was only 1% among the participants.
Wow, that's incredibly low.
It is.
It really highlights the protective power of masks in preventing the spread of respiratory viruses,
Right.
especially for a group that's already vulnerable to complications from those viruses.
Absolutely. It reinforces that point.
Yeah.
And it underscores why the initial concerns about masks being harmful for people with COPD were thankfully unfounded.
So we've seen that masks don't seem to significantly increase CO2 levels or
Right.
negatively impact quality of life
Yeah.
for most people with COPD in this study,
Yeah.
and they offer significant protection against COVID-19.
Yes.
That's a pretty strong argument in favor of mask use.
It is, however, it's important to acknowledge that no study is perfect.
Sure.
This one, for example, had some limitations that we should discuss.
Okay.
Yeah.
So,
Yeah.
so what were some of the limitations of this study? What should we keep in mind when interpreting these findings?
Well, for one, the study size was relatively small,
Okay.
with only 100 participants.
Right.
That means we need to be cautious about generalizing the results to the wider COPD population.
That makes sense.
Yeah.
A larger study would give us more confidence in the results.
Absolutely.
What else?
Another limitation is that the study was relatively short-term,
Right.
lasting only a few weeks.
Okay.
It's possible that longer-term mask use could have different effects,
Sure.
though it's also possible the benefits would simply continue to outweigh any potential drawbacks.
Yeah, that's true. It's like if you were to sprint versus running a marathon,
Right.
you might use different muscles and strategies depending on the duration.
Exactly.
Right.
And this study focused on people already managing their COPD with medication.
Okay.
So it's unclear if the results would be the same for those with more severe disease or those who haven't started treatment yet.
Mm,
It would be fascinating to see future research explore those nuances.
absolutely. And you know what else I was thinking about? The study focused on medical masks,
Mm-hmm.
the kind you typically see in healthcare settings.
Right.
But nowadays, people wear all sorts of masks. Cloth masks, N95 respirators, even those fashionable ones with patterns and designs.
Sure.
Do you think the type of mask could influence how someone with COPD experiences it?
You bring up a great point.
Yeah.
Different masks absolutely have different characteristics in terms of airflow and breathability.
Right.
Think about it.
Yeah.
A cloth mask, especially one with a tighter weave, might feel more restrictive than a surgical mask.
Mm.
And while N95 respirators offer superior filtration,
Yeah.
they can also feel more difficult to breathe through, even for someone without any lung issues.
Right.
So it's reasonable to think those differences could be even more noticeable for someone with COPD.
It's like everyone has a different tolerance for how stuffy a room feels.
Uh-huh.
Some people need a window cracked open all the time. Others don't mind a bit less airflow.
Yeah.
And if your lungs are already working harder than average, that stuffiness factor could become really important when choosing a mask.
That's a great analogy.
Yeah.
And it highlights why it's crucial for people with COPD to work closely with their healthcare providers when making decisions about mask use.
Right.
Their doctor can help them weigh the potential risks and benefits of different mask options,
Sure.
taking into account their individual COPD severity,
Okay.
their lifestyle, and even their personal preferences.
So it's about finding that sweet spot,
Exactly.
maximizing protection from respiratory illnesses, while also minimizing any potential discomfort or negative impact on breathing.
Yeah,
And I imagine that sweet spot might be different for each person, right?
absolutely. It's not a one-size-fits-all situation.
All right.
Some people with COPD might tolerate N95s without any issues,
Sure.
while others might find a simple surgical mask is the best balance for them.
So if you have COPD and you're feeling unsure about masks, it's always best to chat with your doctor and get their expert advice.
Absolutely.
They can help you make an informed decision that's right for you.
I completely agree. And speaking of individual experiences, this whole discussion has really made me think about the psychological and emotional side of mask wearing.
Oh, yeah, for sure.
It's something we haven't touched on yet, but it's definitely relevant.
You're right. We've been talking a lot about the physical impact of masks on breathing.
Mhm.
But what about the psychological impact? After all, not everyone reacts to wearing a mask in the same way.
Exactly.
Right.
For some people, wearing a mask, especially for prolonged periods,
Yeah.
might trigger feelings of anxiety,
Sure.
claustrophobia,
Mm,
or even panic.
right.
And those feelings are just as valid and important to address as any physical concerns.
Especially since anxiety itself can make breathing feel more difficult,
Exactly.
which could then add to the feeling of discomfort while wearing a mask.
Right.
It's like a vicious cycle.
Exactly. And it's important to remember that these psychological responses aren't necessarily irrational or something to be ashamed of.
Yeah.
They're real.
Right.
They're valid.
Sure.
And they deserve attention and support.
So what can someone do if they're finding that wearing a mask is causing them significant distress or anxiety?
Well, first and foremost, I would encourage them to reach out to a mental health professional.
That makes sense.
Yeah.
A therapist or counselor could help them understand those feelings better
Right.
and develop coping mechanisms and strategies to manage them.
Absolutely.
There are techniques like mindfulness, relaxation exercises, and even gradual exposure therapy that can be really helpful in reducing mask-related anxiety.
Exactly.
And it's not just about making mask wearing more tolerable.
Mm.
It's also about addressing the underlying anxiety itself,
Yeah.
which can have benefits far beyond just this one situation.
Couldn't agree more.
Right.
It's about taking a holistic approach to well-being.
Yeah.
And speaking of holistic approaches, this whole deep dive has really highlighted that Healthcare isn't one size fits all.
Right.
What works for one person might not work for another, and individual needs and experiences should always be at the forefront.
It's like we're all unique individuals with our own medical histories, lifestyles,
Yeah.
and even personalities.
Absolutely.
And that all plays a role in how we experience something like wearing a mask.
Precisely. It's a
Yeah.
multifaceted issue.
Yeah.
And the more we understand the different aspects, the physical, the psychological,
Yeah.
the social,
Mm-hmm.
the better equipped we are to make informed choices for ourselves and those around us.
We've covered a lot of ground today.
React.
From the nitty-gritty of CO2 levels to the nuances of individual experiences with masks.
Yep.
But before we wrap up, there's one more question I'm curious about. This whole conversation has been super insightful,
It has.
but we've been focused on COPD.
Right.
What about other respiratory conditions?
Yeah.
If someone has asthma or interstitial lung disease,
Uh-huh.
should they be thinking about masks differently?
That's such an important question.
Yeah.
While this particular study didn't include those conditions specifically, it's definitely an area ripe for further research.
I see.
We know that different respiratory conditions affect the lungs in unique ways,
Right.
so it stands to reason that mask tolerance could vary too.
Makes me think of how some people with asthma are really sensitive to pollen,
Right.
while others are more bothered by cold air.
Yeah.
Those triggers are totally different, even though both can cause breathing problems.
That's a great comparison.
Yeah.
It highlights how individualized these experiences can be.
Uh-huh.
And that's why it's crucial for anyone with a respiratory condition,
Okay.
whether it's COPD, asthma, or something else entirely,
Right.
to have open communication with their doctor about masks.
So they can figure out what type of mask offers the best balance of protection and comfort for their specific needs.
Exactly.
And that might even change over time, right?
Absolutely.
Like if someone's condition flares up or they're going to be in a crowded environment.
Exactly. It's not about finding a one-time solution.
Right.
It's about ongoing assessment and adjustment.
Okay.
And as more research is done on mask use in different respiratory conditions,
Yeah.
healthcare providers will have even more evidence to guide those recommendations.
Sure.
It's a constantly evolving field.
Which is a good reminder that the science around masks is still developing.
Absolutely.
And what we know today might be refined or even challenged by future studies.
Sure.
It's all part of the scientific process.
It is. It's about staying curious,
Yeah.
staying informed, and being open to new information as it becomes available.
Right.
And it's about recognizing that even with the best research, there's still a lot we don't know.
I think it's crucial to emphasize that our deep dive today isn't a substitute for professional medical advice.
Right. I wholeheartedly agree.
We've been sharing information and perspective,
Yeah.
but we are not medical professionals.
That's right.
So if anyone listening has concerns about masks or any other health-related issue, the best thing to do is talk to their doctor.
Absolutely. Your healthcare provider is your most trusted source for personalized guidance and recommendations. They can take your individual circumstances into account and help you make informed decisions that prioritize your well-being.
Well, this has been a fascinating exploration of face masks and respiratory health.
It has.
We started with your interest in COPD, dug into the research,
Yeah.
and ended up covering a lot of ground,
We did.
from CO2 levels to the psychological aspects of mask wearing.
It's amazing how one question can lead to so many different avenues of inquiry.
Right.
And it really highlights how complex and interconnected health issues can be.
It's not just about the physical aspects of a condition,
Right.
but also the psychological, the social, the environmental. It's all interwoven.
And ultimately, it's about empowering people with knowledge so they can advocate for themselves and make the best choices for their own health and well-being.
So true.
Yeah.
Thanks for joining us on this deep dive.
Thanks for having me.
And a huge thank you to our expert for sharing their incredible insights.
My pleasure.
All right.
Stay curious,
Yeah.
stay informed, and stay healthy.
We'll catch you next time for another fascinating deep dive into the world of knowledge, the